Doctors and nurses have read it. Who was the dumbest patient you ever had? Nurse here. Worked at nursing home and had a mid-60s man in for a HAB following knee replacement. Walked in one evening and he was in his bed and had passed away from an unrelated heart attack. Family was called. They came in obviously heartbroken as this was unexpected. They knew he had heart issues but nothing this bad. The man's wife was in early stages of dementia and was upset and saying things in the room like, "Why did you leave me, you bastard?" The age 40-ish daughter pulled me aside, very concerned, and asked me, "My mom is saying some very nasty things. Do you think he is still able to hear her?" Trying to be a pro. I thought for a secretary and answered, "In the sense that Jesus can hear you, maybe. In the sense that you can hear me, no." She immediately hugs me and says, "Oh, what a relief." I've got one. I was working at an Indian services clinic a few years ago. We prescribe a guy Flonase nasal spray primarily for allergies, which starts a conversation. "Guy, will this nasal spray give me anxiety like the last one I had?" Me, "This shouldn't cause anxiety. Let me check your chart to see what it was you had before." I start trying to find which drug he had been prescribed previously, but he says, "I just threw it away in the trash out front. Do you want me to go grab it?" Me, "No, that's okay. It will be in your chart and I won't make you go rummage through the trash." Unfortunately, I don't see any evidence of this dude ever having another nasal spray. And at this point he insists that he is going to grab it from the trash. He grabs exam gloves from the box on the table. Smart move, weirdo, and leaves the room. I can't stop him. He comes back a few minutes later with an albuterol inhaler. I'm perplexed. "Can you tell me how you use that?" "You don't need to actually show me, since that came from the trash." Dude tries his darnedest to shove the opening, meant for your mouth, into his nostril, gives it a squirt and a snort. So yeah, we talked about the difference between nasal spray and an inhaler. I hope he learned. Not a doctor or nurse, but I used to be a receptionist at a family practice. We had a patient call regarding her yeast infection. She was given suppositories for her problem. She told me she took all 3 and still had the infection. I said, "Took? Like you swallowed them?" "Yep, that's what she did." "I'll let the doctor handle that one." A dad calls into the Tridge line for his baby. "Something is wrong with my son's mouth, and he seems to be in pain." "Okay, sir, can you describe to me what you see?" "There are these 2 hard white bumps, like they're growing out from his gums. They seem to be causing him pain. Do I need to bring him in?" "Do you mean his teeth?" I could hear his realization through the phone. Edit, this wasn't his first child. We got calls like this periodically from him. This was just the most memorable to me, haha. Not the patient, but the family/carer. This patient had severe seizures and went into neuro for treatment. Patient was discharged 3 weeks later with a revised medication plan. Fast forward a few months. Patient came in with even more severe seizures. Upon questioning, we found out that the wife stopped giving the patient the meds because he was getting better and didn't have any more seizures. Ag. They're like health potions, right? Guy with type 1 diabetes comes to the emergency department with temp 92 Fahrenheit. Partially obtunded, clearly in diabetic ketoacidosis. History gathered from his uncle who brought him in revealed that this champ has insulin at home. Knows his life depends on taking it and can feel when he is entering DKA. Over the past few days he has been sitting in his room with friends playing Xbox, drinking literal pitchers of Kool-Aid, and not taking his insulin. He brought a bag with him to the emergency department which contained his Xbox. When asked, the patient stated he could tell he was entering DKA and figured he would get admitted, so he should get the Xbox ready to bring with. That's right. He knew his physiology was entering a deadly state of derangement, and his first thought was better pack up my Xbox instead of take my insulin. Had a patient come to the emergency department at 3 a.m. because she woke up 20 minutes prior with itchy/watery eyes and nasal congestion. It was spring. She literally came in for seasonal allergies. I asked what medications she tried to relieve the symptoms. She said my husband told me to take some allergy medicine he has at home, but I didn't take it. So, you're going to pay a hospital bill for the same antihistamines that you have at home? Had a patient present at the ER with blue fingers. She thought she was having some sort of heart attack. She had new jeans and the color stained her hands. Genius. I'm a medical student. Had a pregnant woman who had unprotected sex with 2 different guys in the past month. She explained to me she'd find out whose it was once the baby started talking. I was so confused. Turns out one of the guys was Hispanic, and she was gonna wait to see if her kid would speak Spanish. I work in the emergency room. I was asking a patient about his home medications. He pulls a medicine bottle out of his pocket and hands it to me to clarify something. The label was peeled off, so I open it. It's full of weed. I look at him wide-eyed, not sure what to do next. I recap the bottle, hand it back, and say, "That's not the right bottle." He realizes what he's done and just puts it in his pocket. We move on. All I do at my job is have patients sign papers and explain all the forms to them, and of course if they want to read it themselves they are welcome. But most don't and take my word for granted. Also, as a side note, my name and signature are on some of the forms as well as a witness. One lady comes in and I start explaining the forms to her and she snaps at me saying, "You don't need to explain. I can read just perfectly fine, that's fine. I'm a pretty patient person too, so whatever." So I leave her be to read the forms herself. Then she says, "Who is this person?" pointing at my name on the forms, and I tell her that it's just me. And she replies, "What business do you have being on my forms that I need to sign?" Me, it's just stating that I'm a witness that you and not someone else signed the forms and that you understand everything. Well, I don't understand anything on these papers because you won't explain them to me. Patient came in with severe pain to her feet. Her shoes were too small. Thank you for watching Internet's Funniest. Please like, share, and subscribe for more.